All right, joining us in studio this afternoon, I'm pleased that we have Dr. Jennifer Lafamina, surgical oncologist from the UMass Memorial Med Center, and also with us a genetic counselor from UMass Memorial Med Center, Jillian Sotelo. Ladies, welcome.
Thanks for having us.
Thank you.
It's certainly enlightening to learn more about one of the hidden cancers, if you will, one of the cancers that is very tough to diagnose. And Dr. Lafamina, I know that is certainly one of your specialties, pancreatic cancer. I believe it's the fourth leading killer.
Right, so pancreatic cancer now is the fourth leading cause of cancer deaths in America. And the thing that's so concerning about pancreatic cancer, as you said, is that it's a cancer that notoriously has been difficult to diagnose and to treat until this time.
My dad died of pancreatic cancer, so I certainly have a vested interest in learning more about this and perhaps some of the risks and what family members should look at in terms of, gosh, does it go from generation to generation? You know, what are some of the concerns that people should have, and how can people learn more about that? So maybe you could describe a little bit more about what pancreatic cancer is, if you could.
Sure. I think the thing that's so scary about pancreatic cancer is more and more we're hearing about it. And now it seems as if everybody has been affected. I've been affected. You've been affected. And more and more we're hearing about pancreatic cancer. It's finally in the news and getting the attention that it needs. But pancreatic cancer is a cancer that's notoriously hard to diagnose because symptoms are commonly vague. Patients might have abdominal pain or some weight loss, but it's not until symptoms are much more obvious with jaundice or yellowing of the skin, pale stool, or dark urine, where patients present to their physician for workup. The risk factors are still a bit debatable, but what we do believe is that tobacco contributes to the development of pancreatic cancer, as does pancreatitis. So from a lifestyle perspective, practicing a good lifestyle, abstaining from tobacco, limiting alcohol use, probably does make an improvement in terms of risk. But to speak specifically on terms of hereditary syndromes in families, we know that about 10% of pancreatic cancers are related to inherited genetic syndromes that are associated not only with pancreatic cancer, but also with other cancers like breast cancer, colon cancer, stomach cancer. And Jillian, who's our genetic counselor at UMass as part of the pancreas team, is hopefully going to tell us a little bit more about that.
So, Jillian, if you would, explain to me and our audience what a genetic counselor is and what your role is.
Well, that's actually a pretty common question. So what a genetic counselor is we're individuals that are trained in being able to look at family histories and determine what genetic factors might be contributing to family histories of cancer. And not, every family history of cancer has strong genetic factors, but certainly about 5% or so do, and sometimes more when looking at pancreatic cancer. So oftentimes when people meet with a genetic counselor, they go through their own medical history, and then we go through every single family member. And we also sometimes detect patterns that make us think of maybe one gene over another that might be contributing to many of the cancers in the family. At that point, a genetic counselor helps someone decide whether or not they want genetic testing, because it's really not for everybody. And then we sit with them during that decision process, and we help them also get the test that they need, make sure it's interpreted appropriately. And as you can imagine, there's always emotional repercussions to those test results. So, that's where the counseling piece comes in. And then we also make sure they're getting the right access to all the screening and the care that they would need based on those test results.
So what led you to get into a field such as this? It sounds very exciting, and you provide a wonderful service to families most in need.
I got into this because I really loved genetics, but I learned quickly that I wasn't built for the lab. I talk way too much, and I like being with people. So I wanted to do something in the clinical realm, and I really wanted to focus on the family and not only just treating patients by themselves, but, also their families and their feelings about their diagnoses. And cancer genetics in particular was a good fit for that. So it's just sort of where I ended up.
Dr. Lafamina, how about you? What got you into this particular field of cancer?
Well, the reason I have focused on pancreatic cancer for my career is that pancreas cancer is that cancer that no one's been paying enough attention to. So if you look at breast cancer since 1975, there's been a 14% improvement in the survival. So survival for breast cancer nowadays is greater than 90% 5-year survival. And that's because over the last 30 years, we've seen screening tests with mammograms, treatments and prevention with tamoxifen, and trials. And we just haven't seen that same research funding nor advance in pancreatic cancer. And so the reason that I've gone into pancreatic cancer specifically for my career is really to help bring those to fruition. And of course, there's many wonderful institutions like UMass across the country that are working on that. And together we will get there.
Who should be screened? Is there a particular protocol in terms of where's the net that people should fall into, if you will? And that's probably not the right way to phrase it, but when people are listening, when people are watching on Charter TV3, I don't want to alarm people in the wrong way, but I certainly want to bring attention and awareness so that it's like, gosh, if you can be proactive about this, what's the right step?
Exactly. So the problem, as we were discussing, is there is no screening test for pancreatic cancer. In colon cancer, we have colonoscopy. In breast cancer, we have mammography. In prostate cancer, we have PSA blood tests, and we have digital rectal exams. But we just don't have that test in pancreatic cancer. And therefore, we don't have, the nation at this time doesn't have a screening protocol. However, at UMass, we recently did open a high-risk pancreatic clinic. And in that clinic, we're seeing patients who have an increased risk of developing pancreatic cancer. So patients who have a personal or family history of other cancers that could lead to developing pancreatic cancer.
Is there something that people, family members, should be watching for in terms of pancreatic cancer? Again, the whole purpose today is to learn more about it, to educate people, so that when people think that they might have symptoms or see symptoms, they can get to it as quick as possible. Because again, it is the fourth leading killer, as we've shared the information today. There isn't a whole lot of funding, apparently, unfortunately, that hasn't been attached to this. So again, what proactively should people be looking for?
So I think a two-part answer. The first is that symptoms that just won't go away, like that nagging abdominal pain attributed to an ulcer, we need to pay more attention to. So if you have unexplained weight loss or a vague abdominal pain, I would seek additional workup. And of course, many times it might just be that ulcer, but more and more we're seeing that these do turn into pancreatic cancers. But from a perspective of people who are at an increased risk, we really want to get the word out of who those people are. So for those patients, symptoms that are not obvious, they should seek care from their primary care doctor or a doctor that manages pancreatic cancer earlier rather than later, because those are the patients we might just be able to catch early. But additionally, as part of the high-risk clinic, people that we know are at an increased risk, we're inviting those patients who, and we have a set of criteria that we use to know who's at increased risk, to invite those patients and both they and their families to hear more about what those risks are and potentially embark on a screening protocol that we've established at UMass.
So Jillian, is there a kind of like a punch list, if you will, that people should follow in terms of, gosh, here are some signs I need to jump on this?
Yeah, I think the red flags that I really look at are when you start thinking about your family history and you start noticing that maybe more than one person has had pancreatic cancer, particularly at a young age. We know that people that have two first-degree relatives, a mother, a brother, a child that have had pancreatic cancer are actually at a quite increased risk of pancreatic cancer, sometimes up to 7% or greater. And also if you're looking at your family history and you start seeing multiple generations with people with maybe many different cancers at younger ages, I sort of use 50 as my rule of thumb, or people that have cancers you wouldn't expect, for instance, male breast cancer, then I think that that's a good time to talk to primary care and say, do you think genetics could play a role here, and maybe ask to see a genetic counselor. For people that come into our clinic, most of them have a family history of pancreatic cancer, other factors that are putting them at risk. And so we sit down with them and have a consultation. I look at their family history and determine what genes might be appropriate. There are some genetic changes that would only slightly increase that family risk, and there's some genetic changes that could lead them to have a 60% lifetime risk. So it really depends on what's in the family and making sure they get the testing so they get a more accurate idea for both not only themselves and, so that they can feel like they have the most information that they need, but also for people like Dr. LaFemina to establish a care and screening program for them that would be appropriate.
Oh, it's very helpful information. And again, I think the beauty of all of this is I hope we're able to catch a couple people kind of in the act in terms of, gosh, that sounds like me, or that sounds like someone that I know, that I love, that I care about. And again, not to alarm people, but to educate and inform people so that, again, with that shortened window with pancreatic cancer, they can get to their primary care physician. Underscores once again the importance of that annual physical exam, so people will take those proactive steps.
Well, and I think, both myself and Dr. LaFemina didn't get into this, to make people lose sleep at night or to scare them. We both got into this because we both feel really strongly that, if there's something we can do or early detection, that hopefully we'll be able to come up with new treatments or something that'll keep people alive. And, many patients find this information empowering. I think it can be scary at first because we're talking about you and your family, and many people have had experiences with pancreatic cancer coming in, but certainly when you give people something that they can do, that makes them feel a lot better. They don't feel quite as, like it's up to the fates.
Sure. Well, Jillian and Dr. LaFemina, if you can hang with us, we need to take a quick commercial break, but with the advent of the internet and more information being available to people, what I'd like to do is maybe talk a little bit about how people can learn more about this so that they can become more informed and educated. So we'll come back on the other side on News Talk 580, 94.9 FM WTAG. It's 20 minutes after 3 o'clock. The Jordan Levy Show, Mike Marcy from Charter TV3 pinch hitting this afternoon, Monday afternoon.
This is the Jordan Levy Show.
And he has more hair on his eyebrows than I have in my head.
On WTAG.
3:25 on Monday afternoon, July 1st, News Talk 580, 94.9 FM WTAG. My name is Mike Marcy. I'm here with Dr. Jennifer LaFemina from UMass Memorial Med Center. She is a surgical oncologist, and also Jillian Sotelo, a genetic counselor. Gene testing, I'm sure that is something that people, if they haven't thought of, they should be thinking of. And when they start thinking of that, they're probably going, gosh, what are my cost outlays going to be on that? What will my insurance cover? Do people ask you questions like that?
I think that's probably the number 2 question I get after what's in my family. With gene testing, it is very costly. To test a single gene can run anywhere from $1,000 to $6,000. The good thing about our coverage here in Massachusetts is that most of our insurers actually cover this testing if it's appropriate for our family, and that's something that we can assess. Cost is always something we talk about. For those very rare instances where insurance will not cover the test, we actually have grant funding that we can apply for through the Cancer Resource Foundation. They're an incredible organization here in Massachusetts. People have to meet medical criteria, which they often do, and that's something that a genetic counselor can assess. And then they have to meet the financial criteria, which is not terribly stringent. So we're able to sort of get them testing through that way so they get the appropriate care that they need. And, we're oftentimes very successful in making sure this testing's covered. I would never want a patient to end up with a huge bill for something that, is certainly going to impact their life, but isn't, like emergency care. So it's something we work really hard to make sure is assessed and taken care of for patients.
That's a very scary time for people who are fearful of that. And then once, if, heaven forbid, they do get that diagnosis, it's like, gosh, what steps do I need to take right now because the clock is ticking and walls seem to be closing in awfully quick.
Yeah. And I think getting that information is so key. And that's what's nice about this new clinic is it's multidisciplinary. So, I can kind of do the family piece, and Dr. LaFemina is able to give more specifics to a patient and has immediate questions so that if I can't answer them, they're there as a resource.
Terrific. Dr. LaFemina, we talked about educating patients and families, and I believe there's a symposium coming up in this fall in November.
This fall. So the 5th annual UMass Pancreatic Symposium will be Monday, November 18th. And the topic for this year will be high-risk pancreatic diseases. And we invite everyone to attend. It's a free event, and we look forward to seeing everyone. In terms of getting more information, not only about the pancreatic team and the high-risk pancreas clinic, I would invite the listeners to use 2 phone numbers, 866-597-HOPE, which is the UMass Hope line, and also my office number, which is 508-334-5274, and we book appointments through that number. If you'd like more information in terms of these syndromes, the ones that increase risk, our website is now updated to show those that information. So if you go to the UMass Cancer Center of Excellence website, all that information is right there and easily accessible. But I'd like to talk a little bit about the Pancreatic Cancer Alliance also. We're here today to get the word out on pancreatic cancer, and we can't do that alone. And we really appreciate the time that you've allowed us to be here to get that word out. But it requires everybody. It requires all of the public to spread the word, because that's how we're going to get pancreatic cancer in the news and make a dent in survival. And the Pancreatic Cancer Alliance has been instrumental in doing that, not only in terms of getting the word out, but also in research funding, allowing for those new steps that were going to make a dent in the survival in pancreatic cancer. And the Pancreatic Cancer Alliance is a volunteer organization here in Worcester. And they're intimately in collaboration with the pancreatic team at UMass, and we thank them every day for their collaboration.
Excellent. We're kind of run out of time. The half hour really flew right by.
Yeah.
And Jillian, any closing words? Anything that we didn't cover that you think is important to kind of get out? And I know we've kind of steered people towards websites where people can look, phone numbers where people can call if they want to learn more about this. But it's just such an important topic.
You know, it really is. And, you know, I would second that advocacy is the biggest part. And then also just take a look at your family history and take a deep breath and don't be afraid to ask those first questions. It's always about that first decision and, you know, going and asking some of those first questions to get there. And you may be surprised. You may feel really good after hearing the answers. And we may say you're doing great and your family history doesn't look as concerning as you think. So I think there's a lot of fear around this topic, but until we get talking about it, you know, we're not going to be able to take those steps we need to take. So don't be afraid, look into information, and, you know, certainly give us a call if you feel like it's appropriate.
Excellent. Jillian, thank you very much.
Absolutely.
Dr.
Thank
Lafamina, we're
you.
going to save the last words for you. Any other closing information you'd like to share?
No, I think just I want to repeat what we talked about earlier, which is that if you look at other cancers like breast cancer or prostate cancer, we've made huge impacts in those cancers in the last 30 years, and we just haven't done that with pancreas cancer. But I think now's that time, and I think altogether getting the word out and getting research funding, we're really going to make a dent and hopefully find a screening test and find better treatment options. So maybe 30 years from now, we'll be looking back and saying, you know, pancreas cancer really was the next breast cancer.
Excellent. Can we give the phone number out one more time?
Sure. So it's 866-597-HOPE, which is the UMass Hope line, or 508-334-5274.
Jillian Sotelo and Dr. Jennifer Lafamina, thank you so much for sharing your time and your information and just making people more aware of something that people need to learn more about in terms of a tough cancer to diagnose, but more strides are being made. So thank you for the wonderful work that you're doing at the University of Massachusetts Medical Center. Thank you.
Thanks for your time.
Sure.
Absolutely. Thanks for the opportunity.
It is 3:31 on WTAG. We're going to be back after some traffic and weather updated information.
This is the Jordan Levy Show.
Look, I went to a transcendental meditation course so I could learn to relax.
Was that with or without Ozzy?
No, I didn't go with Ozzy. Ozzy goes to his own.
On WTAG.